Good evening and welcome to another edition of Talking About Live. Yes, we are coming to you live from the Queens Public Television studio in downtown Flushing, and we welcome your questions, your comments, anything you'd like to say. Please make it nice. The telephone number, which will be displayed up on your screen, is area code 718-460-9802. Now, with us this evening is a guest that we had spoken with a few months back, and she was definitely one of my favorite interviews of last year. And she is the Vice President of the Eating Disorders Council of Long Island, as well as an individual psychotherapist specializing in group and marital counseling. Her name is Cynthia Pizzulli, and we'd like to welcome you back once again. It's great to see you.
Oh, thanks, Chris. It's wonderful to be back.
Now, yesterday happened to be the Super Bowl, with Super Bowl Sunday. And the first thing we have to associate with Super Bowl Sunday is now buffalo chicken wings, fried chicken, mozzarella sticks, potato chips, pretzels, dips, beer, and all that kind of good stuff. And it just makes me think of how food seems to figure into so much of what we do in life. In fact, it figures into what we do every single day. And unfortunately for some, it becomes an addiction, and it becomes a very difficult thing to manage. And I was wondering if maybe it's a worse addiction than something like drugs or alcohol, because you need to eat to live. What would be your stance on that?
Yeah, I mean, it's unfortunate when you're talking about eating disorders, you can't actually abstain from eating food, where you can abstain from drugs and alcohol. And although there are many 12-step programs aimed at helping people with eating disorders as well, has a lot of different dynamics because of that reason. And I'm sure that those who've eaten a little bit more than they felt comfortable with on Super Bowl Sunday started new diets today, and are now saying, I shouldn't eat this, I should eat this. Oh my God, I can't believe I ate that yesterday. I'm going to be so fat, I'm a pig. And there becomes the obsession, and the roller coaster begins.
Now, what happens to the people that started the diet on New Year's Day and then all of a sudden had to go off it for Super Bowl Sunday, and then Valentine's Day they get candy again, and then soon Easter is rolling around, or St. Patty's Day, and we're faced with the same problems. How does a person manage an addiction like food when it does figure in so predominantly to what we do, our holidays, our religious beliefs, just socializing with friends and family? Now, a person, say, that may be able to have a glass of wine occasionally and it doesn't become a problem, they're not an alcoholic. But somebody who has a problem where they start eating something they shouldn't, one potato chip begets another, and all of a sudden it becomes a very big problem. What is the first steps in dealing with something like that?
Well, when you're dealing with an overeating problem, someone who continually indulges in overeating, large amounts of food, and then feels shame and guilt following, and then does things to compensate, either by restricting behaviors or, in some cases, taking laxatives, diuretics, vomiting, and so on. We're not necessarily talking about addiction per se. When you're dealing with eating disorders in the mental health community, we like to look at eating disorders more as an emotional disorder that's not as much addictive, but adaptive. There's a reason that a person is overeating when they're overeating. To just say that, oh, this is a willpower thing, you've got to learn to stop doing what you're doing, get control, get a grip, we're not really addressing the problem. If someone's using food either to comfort themselves or deal with anxiety or cope in a social situation, let's say, sometimes people eat a lot more in social situations because they don't know what to do with themselves in those situations, and they eat basically to feel like they're doing something. But someone with, let's say, a full-blown eating disorder or real disordered eating will be using that binge eating behavior in order to adapt to their lifestyle in some way. Somehow it makes them feel safer in their world. And then, unfortunately, they feel overwhelmed, shame, guilt as a result of that behavior as well.
I know this is a difficult question, but what would be a catalyst that would start someone on the road to such behavior or having a disorder of such magnitude? Is there a genetic predisposition? are there traumatic events in one's life? What have you found from your experiences might be some of the catalysts?
Well, the thing about eating disorders is it's multifaceted. There are so many causes or underlying reasons someone would develop a full-blown eating disorder. On the surface, you do have the pressure from the media and peers and family members to maintain a really specific body shape and size, and that can be extremely difficult to fight off, and oftentimes people develop these behaviors because they feel so much pressure and they feel ashamed of eating because their families have preached this kind of, you shouldn't eat this, good foods versus bad foods, what I should be eating, what I shouldn't be eating, and then the media pressure to have a highly specific body shape is shown in movies, on MTV, in magazines. So you do have that on the surface as one of the reasons that people are, overly concerned with their body nowadays. But then in addition, someone with a full-blown eating disorder also has a lot of interpsychic conflicts, we call them. And there is a predisposition to eating disorders when a person has grown up not feeling really in control of their lives, feeling ashamed and guilty about who they are as a person. Someone with an eating disorder values themselves based on how they appear rather than who they are.
Now, by them, say, an anorexic not eating or being in control of their weight, is that symbolic for them being able to control their lives when they feel that otherwise they have no control over their destiny or over the course of their lives?
We find that a lot in the community. Many practitioners who treat eating disorders notice that patients with anorexia and bulimia and other types of eating disorder types do feel an extreme lack of control and lack of empowerment in their lives. And just think about this. What is more powerful than having control over what you eat and don't eat? No one can make you eat.
Yeah.
No one can make you not eat. It's quite empowering in eating disorder when you think about it. So those who suffer with eating disorders do tend to use it as a way of getting back that control.
Okay, people, if you're just joining us now, we're with Cynthia Pizzulli, the Vice President of the Eating Disorders Council of Long Island, and appropriately we are discussing the multifacets of eating disorders. Please feel free to call with your questions and comments. The number is on your screen, 460-9802. Now, for the edification of some of our viewers, some of the eating disorders, of course, we've heard of anorexia, bulimia. Are there others, in addition to them, that we might not be aware of that are just as threatening?
Well, yeah, I alluded to that before. A lot of times we look at eating disorders more on a continuum. Let's look at disordered eating per se. Just because a person, let's say, is skipping meals or restricting or severely dieting or maybe dabbled a little bit in some of these purging behaviors doesn't mean they have a full-blown eating disorder. We may say that they have disordered eating, which would be in the middle between completely healthy and full-blown eating disorder. When it kind of stretches along the scale towards the real diagnosis of an eating disorder, we see anorexia nervosa, bulimia nervosa, eating disorder not otherwise specified, which is someone who doesn't necessarily meet the criteria for those two diagnoses. But there's pretty much not much difference between those diagnoses. There's a severity of weight loss. For instance, the difference between anorexia and bulimia is the percentage of body weight that a person has lost. In anorexia, one has lost more than 15% of what's considered normal body weight for one's height. And in females, they've lost their menstrual periods for over 3 consecutive months. So that's the main difference between the diagnoses. But that person with anorexia or bulimia would still be obsessing with food and weight and body image and what they should have eaten, what they shouldn't have eaten. Their thighs are touching, or their butt's too big, whatever it is. Someone who's binge eating, we call that binge eating disorder or compulsive eating disorder. That's really just another form of the bulimia, let's say. Most people that overeat do try to compensate by not eating for long periods of time and oftentimes over-exercising and taking the diet pills and so on. So it's more of it's not exactly as clear cut as, you fall into this category or fall into that category.
Right. Now, somebody coming to you for the very first time, seeking your help with a problem, say by means of even an intervention where there's a large caliber of denial, and they're not fully aware that they even have a problem, but it's been more the intervention of the family or friends that have made them seek your attention, and I'm sure you've been in this predicament. What is the first approach you would take in dealing with someone who clearly has a problem but denies it emphatically that there is a problem? How would you do that?
I'm sure that everyone in your audience has been in a situation where they've known someone they've cared about who has had some type of problem but didn't want to acknowledge it. It is very difficult to get somebody to see something they're not ready to see. So I always make the assumption that I can't force somebody to get help they're not ready to get. But if a person is somehow coerced or manipulated in some way into my office, then I might say, listen, I just want to know if you're happy with yourself. Is your life fulfilling? Are your needs being met? Is there a way I can help you with this piece? If you could start off a little bit, gently, I would say, then oftentimes I could find some level playing field in which to approach the problem. But you cannot force somebody to get help if they're not ready to get it.
Okay. We'll hold that thought for a second. We have a phone call. Dan from Queens, you're on Talking About Live. Welcome, Dan.
Hi, Chris.
Hi.
Yeah, Chris, I love your show. Just want to tell you that.
Thank you.
Hi, Dan.
Hi. I just have a question. I have a friend who has a very poor self-image, and he's constantly down on himself. And I try and listen. I try and be there. What can I do to help to lift his spirits and to help him have a better self-image?
Cynthia.
Well, it does sound like you're a good friend because you are taking the time to call today, and I think that's the first step. Hopefully he's listening and he'll understand that you really are concerned about him, and your main objective is to help him be more happy with his life and himself. Keep in mind that one of the most difficult problems with eating disorders is the impotent feeling that family members and friends have with this problem, that they can't affect a positive change. And the same thing holds true for someone with low self-esteem or a body image problem. Your friend is probably struggling with a lot of issues as far as how he feels about himself, and not only about his appearance, but probably his performance in his work, in school if that's appropriate, at home, in his relationships. So just being there for him is the key. I think that just sharing your concerns, not playing, police. I don't think that's good to just say, you shouldn't do this, you shouldn't do that. Stop thinking that. Why do you keep saying that? Stop saying that. That doesn't make a person stop doing those things anyway. It's kind of a fruitless effort. So just listening, and then keep in mind that at some point you have to have a boundary. You may not be able to be there for him to solve this problem, and you may need to just let it go at some point and say, this is the way he is for now, and if he's not willing to change or get the help he needs, there's not much I can do about it.
Okay, thank you very much.
Thank you,
You're
Dan.
welcome.
Have a good night.
Okay. Now, one thing I've wanted to ask you, and it might be interesting to the guys in the audience, in recent decades, in the last 10, 20 years, we've kind of had a role reversal, particularly in the media. And the way women have always been stereotyped as desirable and as pinup girls and so forth, men now are being faced with the same issues, and they're finding themselves, whether awarely or unawarely, under the same stress of having to maintain a physique, worrying about how they look, if their hair is receding, if they have the right clothes or the right look and so forth. In your practice, now people would think that anorexia nervosa and bulimia nervosa is confined largely to women, but I'm sure this is an illness that also affects a great deal of men, especially in recent years. Is that true?
Absolutely. Eating disorders do not discriminate based on gender, race, economic situation, sexual orientation. It's something that we have always thought of as a female, adolescent, athlete, ballet dancer problem. That was traditionally the way we looked at it. But especially nowadays, it is much clearer that men are developing eating disorders at a higher rate than previously thought.
And is it starting at an earlier age?
It's starting, we find that most eating disorders, although there are late onset eating disorders, there is, like I said, it doesn't discriminate on age either, that most people develop eating disorders when they are developing, okay, when they are starting to go through adolescence. Think about adolescence as the most chaotic period of development, where the big question is, who am I?
Yeah.
Am I acceptable? Who am I going to be? What is my purpose here? So that is the time when all these bodily changes occur also, and the need to be accepted as a desirable object is extremely important. And it was more important for women, but now the focus on men as desirable is much more prevalent. So we do see that, and in my practice I do have many males with eating disorders, full-blown bulimia and anorexia, mostly bulimia at this point, but anorexia as well. These are guys that work out, 24/7. They miss a day of working out. Don't go near them because they're going to be in the worst mood. If you have a sports injury, having to recoup from that is quite traumatic. So we do see that quite frequently.
Now, with the sports injuries, is it predominantly because they feel that their worth is based on their ability to be athletic or their ability to perform their job efficiently? And if they can't do that, then they have no worth.
Yeah, as somebody who values themselves based on appearance and performance, that would apply also for performance in athletics, for men and women as well. An injury would be a precipitant for that kind of behavior. We find that.
But do we all do that in our particular careers to an extent? I'm a writer, a director, a producer here with QPTV, and if I haven't written what I feel is up to par or whatever, I can get very down on myself. Or if I'm not doing my job the way that I think I should be doing it, I can get very down on myself. I could speak for a lot of actors that when they feel they're not up to par, they feel almost worthless. I don't know if totally worthless, but they definitely feel disappointed. Is that a natural reaction in people? Or if you feel you've had a day of counseling where, like, damn it, I just didn't get through to this person today. Where am I missing the mark? And you can go home maybe feeling a trifle less than you had when you woke up that morning. But then, of course, I guess the dividing line is when it becomes neurotic opposed to disappointment.
Yeah, I think that it's important to understand that we all have a certain amount of passion for professional excellence or personal excellence, and being passionate or even obsessed about doing well is not in and of itself a problem. It only becomes a problem when it interferes with your functioning and is out of normal range. And that's why sometimes mental health practitioners, we have to define what's within normal range, because we need to flag the things that fall outside the normal curve.
And that's basically what you have to track first and foremost.
Absolutely, absolutely.
People, this is Talking About, if you happen to be surfing through the channels, and we are talking with Cynthia Pizzulli, the Vice President of the Eating Disorder Council of Long Island. And we welcome your questions and comments. We are coming to you live February 4th, 2002. Please feel free to pick up the phone and call the number on your screen, 460-9802. We welcome your input. And I know as I'm speaking, there's got to be at least one person out there who's feeling kind of down today, who's kind of blue over whatever matter. And it leads to another point that I wanted to bring up to you, which had to do with self-image and self-esteem, which very often is at the root, I would imagine, I mean, I'm not a professional therapist, but would be at the root of most neuroses and most problems that can ensue into addictions and so forth. Where does self-image and self-esteem problems originate? Where is that path in a person's life where something goes wrong and someone just goes off the track that they should be, and all of a sudden starts to perceive their world and themselves inaccurately?
Well, we do hope, as parents, that we're going to raise our children to feel good about themselves and have worth as far as their academics and their performance in their hobbies and with their relationships with their peers. But keep in mind that we don't always know what makes somebody not feel confident about themselves. We can say that it's about the upbringing, that if you don't raise a child to feel those things, that they're going to end up with low self-esteem. But I've done a lot of work with many different types of families who have done phenomenal jobs of parenting, and still, with this society the way it is, it's sometimes very difficult for a person to grow into a autonomous, healthy individual. So, it's hard to say what incidences might occur that would cause low self-esteem. I haven't met an adolescent that had high self-esteem.
Really?
I think that the whole point is that, you start to find yourself in that whole process through your relationships with others and what we call mirroring. Through those relationships, hopefully you have healthy relationships, and the people that you come in contact with, they're able to validate you as a person, and that gives you the tools you need to cope more effectively with your life as an adult.
Great. Let's hold that thought for a second. We have a call. We have Barbara from Queens. Barbara, welcome to Talking About. You're on with us live.
Hi, how are you?
Hi, how are you?
I'm very concerned about my niece. She's I don't know if she has an eating disorder, but she has a strange way of eating. She has to have a certain food every day, and the same thing every day, and also she exercises beyond what's normal. She'll actually tell me that she's in pain, but she has to keep exercising. She'll do it for hours at a time, and I'm concerned about her.
Barbara, how old is your niece?
She's about 22 or so. She's recently had a breakup in our relationship, but she's had this pattern for a while. Is that an anorexia? Is that anorexia, or what is that? Just an eating problem, or?
It is possible that she is experiencing some type of disordered eating or eating disorder, but that's not something that I would be able to tell you without actually doing an assessment. She needs to have a professional really ascertain whether or not she has that type of problem. But there are ways that you could possibly help her, Barbara. Are you very, very close with her?
Yes.
And would it be okay for you to tell her that you're concerned about how she feels about herself?
I have already told her that.
And what does she tell you, that she has no problem, stop worrying about her?
She says that she doesn't know why she has to do this, but she does it every morning. She has the same thing for breakfast. And, this is every single day. And she has to have it just so. And I'm just concerned that she's developing something.
I would say that there are a few more things that you can try before giving up. And clearly, as I said before, it's very difficult to get someone to the help that they need if they're not ready to accept it as a problem. But you can tell her that, talk in the first person and say, wow, if I was thinking all the time about exercising and what I ate, and I had these really strict rituals, I would be so happy with my life. It would be really stressful for me. And I was wondering, maybe you should talk to somebody about that, because it must be really difficult for you, every day having to worry about these things. That's a more subtle way of approaching it, rather than saying, you have a problem. I think if you don't get help, this is going to be a big problem. That's more confrontative approach. More passive approach can be more effective oftentimes.
So ask her if she is unhappy?
Absolutely. Ask her how she's feeling about herself and if she's unhappy. And is she happy with doing these things in her life? Would she like some help in trying to stop?
She doesn't seem to be too happy about anything.
That wouldn't surprise me. And most people who are stuck in these rituals, we call them, they have so much shame that they're doing them to begin with. But then they have shame and guilt if they stop.
She also sleeps a lot, too.
Yeah, well, these kind of behaviors can cause a lot of exhaustion, and also if she's suffering from clinical depression as well, she's going to have a lot of difficulty trying to kick this type of problem on her own. The most important thing is that eventually, if she gets help, she can recover from this problem. That's the most important thing here. And if you can just hang in there and give her support, if there are other folks close to her that may be able to help with this as well, it's possible that you can be of great assistance to her.
Well, I do my best. I do my best.
Just the fact that you called today shows that you're very concerned and you love her very much, Barbara.
Thank you very much.
I wish you the best of luck.
Thank you.
You're
Good
welcome.
luck to you, Barbara. Thank you for calling. That kind of ties into what we were saying a little bit earlier, where in an instance of, say, an intervention or people wanting someone close to them to seek help or to seek counseling, that seems like such a difficult thing to do when a person is resistant or just unwilling to go to that area and admit that there is a problem.
Absolutely. That is one of the most difficult, I think I mentioned it before, but I could say it a million times, the most difficult problem in dealing with eating disorders is being able to accept the impotency of just not being able to do anything about it. It doesn't matter if you're talking about a minor or an adult, it's just excruciating to watch someone that you care about feel this way about themselves and not be able to change it.
But it's basically that you have to just make gentle and ginger steps. I think that's one of the most important things to stress to people who are watching right now, who may be in that situation themselves or know people who are. The very first steps have to be small. They have to be the baby steps.
Mm-hmm.
What would you advise to someone right now who, in a moment of clarity, might know that they have an eating problem? What would you say to them?
It's important, anybody out there who thinks they may have an eating disorder or a disordered eating problem, I say disordered eating to refer to not a severe diagnosable form of an eating disorder. And anyone out there who has any type of emotional problem, keep in mind we're talking about eating disorders today, but a lot of the underlying psychological issues that are associated with eating disorders are across the board with other disorders as well, like anxiety disorders, depression, drug and alcohol abuse, obsessive compulsive disorders. So if you feel like you're not able to cope effectively on your own, reaching out is not such a bad idea. A lot of people do see counselors. I think it's the thing to do anyway in the year 2000, 2001, 2002. Everyone's going to therapists, so I guess it makes it a little bit more acceptable.
I think it's just sometimes a good idea to have a professional, educated, objective ear, even as a mirror or a feedback for basically what you're going through.
It's true.
We have Maria on the phone. Maria from Queens. You're on Talking About Live. Welcome this evening.
Hello.
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 Hi, Maria.
How are you?
Okay. How are you?
Could you give me some input on obsessive compulsive disorder as far as getting any type of therapy?
Sure, Maria, obsessive compulsive disorders, and I guess let me make a segue, a brief one. An eating disorder involves an obsession and a compulsion to
Could you distinguish the two, obsession and compulsion?
Yes, I'm going to do that, and then I'm going to explain the difference between an obsessive compulsive disorder and an eating disorder, okay? An obsession is basically about your thinking, how your thought processes work. Someone who obsesses is thinking about something over and over again, like a tape that doesn't have an ending to it. It's like a never-ending loop. And a lot of times a compulsion results to engage in behavior over and over again. Sometimes people just have obsessive disorders, sometimes they just have compulsive disorders, and sometimes they have obsessive compulsive disorders that involve both. In eating disorder, it sounds like an obsessive compulsive disorder because it involves obsessions with food and weight and body image and body shape and fat grams and so on, and then results in certain behaviors. But an obsessive compulsive disorder alone we look at more as a type of anxiety disorder, that a person has a general anxiety for whatever reason and is using these thoughts and behaviors in order to cope more effectively with certain feelings that they're having, mostly negative feelings. And a lot of times we recommend that people with obsessive compulsive disorders see a behavior therapist or a psychotherapist with which they can develop a healthy relationship and start to make changes to the way they're thinking and the way they're behaving. And a
Well-
lot of times folks with obsessive compulsive disorders do benefit from taking medication, as do folks with eating disorders as well.
Well, as far as medication goes, I've been tried on 7 different medications, and none of them seem to be working because of the fact that I didn't take my therapist serious enough to seek therapy with a therapist for helping me with the ways to show me how to get out of this.
So
The
at this,
strategies, the different strategies I need to be taught.
so you haven't actually been following through on the strategies as of yet.
No.
Okay. Well, a lot of you're not the only one who might feel that way. It's very hard to make change. Human beings do not deal well with change. We try to resist it at all costs. So a lot of times what we do is we repeat behaviors that we say we want to stop, even though it's a very difficult situation. So when you're ready, hopefully you will try to initiate some of those techniques that have been taught to you by your therapist. When you're ready, go back to your therapist, start implementing it again. See if you could start from scratch and kind of take baby steps towards making those changes. And keep in mind, I'm not a psychiatrist, so I don't prescribe medications, but the right psychopharmacologist can help with that, because if you're on the right medication, it can help you make those changes more effectively.
Mm-hmm. Okay, thank you very much.
You're welcome, Maria.
Thank you.
Good luck.
Good luck to you. Well, as we were saying a little bit earlier, with obsession and compulsion, now, is that often a precursor, that kind of behavior? Is that a neurosis that could be a precursor to an eating disorder?
Well,
Or is it separate?
You might have folks with eating disorders who have obsessive compulsive features as well. You might have people with eating disorders who don't have obsessive compulsive features. Some may be depressed, some may not. Some may have all sorts of bipolar disorders or personality disorders. It runs the gamut. Keep in mind that there's so many folks with eating disorders. We see that it's running epidemic proportions. That then the general population suffers from all of these other problems as well. So you're bound to get someone with anorexia or bulimia also suffering from one of these other problems.
Is there a statistic nationally of how many people, like of the general population, are afflicted with eating disorders? Is there something like a 30% or?
Well, as a rule, I try not to actually quote statistics without my references on hand.
Okay.
But I can tell you that it has been shown that anywhere within the adolescent female population, that anywhere from 5 to 7% of adolescents have engaged in bulimic behaviors or compensatory behaviors to make up for eating, dieting, taking diet pills, vomiting.
And it's so scary that diet pills to this day are still prescribed very actively, that are proven amphetamines and dangerous, and are so frequently prescribed by doctors.
Well, everyone wants to lose weight and everyone wants to make a buck, so
yeah, and that's,
I would think that there is always going to be someone who's going to develop a product like this that will be geared towards helping people curtail that need to overeat.
If you're joining us now, we are talking with Cynthia Pizzulli, who is the Vice President of the Eating Disorder Council of Long Island and individual psychotherapist. This is Talking About. We are here live this evening, February 4th, 2002. We welcome your questions and comments at the number right on your screen, 460-9802. Now, Cynthia, you were also saying something that was that I found interesting, that people that came from normal upbringing, where there were loving parents and 2 parents there and a very supportive home and so forth, still found that they had poor self-image, which you would think that would have to be grounded in a family that was somewhat dysfunctional or unloving. What would cause a person that was surrounded by support and by love of family and friends to have a poor self-image?
Well, I probably would need to examine that on an individual basis. Clearly, a person who grew up in a family where there wasn't the appropriate type of nurturing would be more likely to develop self-esteem problems. But keep in mind that once that child leaves the home and spends 9 hours a day in another environment with their peers, all sorts of problems can arise, and you know that kids can be cruel. You know that there are a lot of stressors for today's youth, trying to fit in and so forth. So I think that we can't really pinpoint the exact reason that somebody would develop it.
Okay, if we just hold that thought for a second, we have Ann from Flushing. Ann, you're on Talking About Live.
Yeah, I'd like to know if you know anything about Tourette's syndrome, whether that ties in with obsessive-compulsive disorder.
Tourette's syndrome.
Hi, Ann. I'm not an expert on Tourette's. I have worked with some families with some children with Tourette's, but you probably would be better off looking for a specialist on Tourette's to answer those questions. But I don't know if there has been any research looking at the relationship between eating disorders and Tourette's, or eating disorders and or Tourette's and obsessive-compulsive disorders. I'm sure there has been, and it'd also be a good area to further examine. So, is there a specific question, though, that you had about Tourette's?
No, I just wanted to know if Tourette's syndrome follows by obsessive-compulsive disorder syndrome.
Tourette's is a different type of problem because it involves, I believe it also involves certain tick disorders,
Right.
and so on, which are much more neurologically based. So I'm not going to be able to comment much on that. I apologize for that. It's not my
Okay.
area of expertise.
Thank you, dear.
Good luck, Ann.
Thank you, Ann.
Bye.
Now, in the event of someone with a poor self-image or self-esteem problem, or even an eating disorder, now, say they're on the process to recovery, is it something that you find throughout their life becomes a chronic condition? Is it something that will always have to be managed and maintained? Say something even like anorexia or bulimia, or is there a point where recovery is achieved and they don't have to continue with therapy or continue with managing their eating habits so stringently?
Well, I think I've said it before, but it's worth saying again. I wouldn't do this type of work in treating eating disorders if I didn't see people recover. You absolutely can recover from an eating disorder. There are some folks that will recover completely, will no longer obsess about food and weight. It's more like, those folks, it's more like if you've ever been afraid of the dark. You don't know the exact moment in time where you no longer were afraid of the dark. You no longer needed to sleep with the light on. It works more like that. But much of this is dictated by how long a person has suffered with the problem, when the onset was, whether or not they've gotten treatment early. So those are the factors that I would take into account when deciding the prognosis for a patient.
Okay. We have James on the line. James from Queens, you're on Talking About Live.
Good afternoon.
Hi, James.
Good afternoon.
I noticed you mentioned about people that are overweight and eating disorders. Majority of the disorders of eating is mostly the food today they eat. A lot of this fast food contains a lot of chemicals and a lot of poisons in there. And if the person does not detox the body, get rid of all those waste products from the body completely, then the person won't be able to heal, because all you're doing is putting another drug on top of another drug. And being that this society is so drug conscious, that majority of the drugs that are on the market today are not even designed for the person. The person would have to go to a holistic doctor and have some sort of medicine designed for his body. But when people become so psychic and so crazed over the garbage that they advertise on television and radio and advertisements for this magic bullet to sort of lose weight or whatever, they're only putting themselves in the worst condition.
James, and you bring up a lot of good points. I'm not actually a nutritionist, so I won't really comment too much on the food end of things. But keep in mind that there are a lot of folks who do overeat, who indulge in a lot of fast food eating behavior, and a lot of that has a lot of carbohydrate content and a lot of sugar content that can cause a yo-yo effect with the body, so it causes cravings, and it makes people who are trying to stop overeating need to overeat more because of that kind of blood sugar roller coaster that goes on. So, but I think I'll have to keep that for a nutritionist when you have that person on the show.
I would agree with you, James, that definitely the fast food that's so much a part of all our lives today could definitely play a part in, at the very least, poor nutrition and poor health. because people are living such active lives, and very often you have both spouses in a household that have to work. A lot of people just are too tired or don't have the time to cook and to prepare healthful meals, and a lot of the time it could evolve into poor habits, overweight, etc. Definitely agree with that.
But,
But,
being a big fan of Big Macs, I do want to say that, you know, anything in moderation is certainly healthy and within normal range. So to say that no one should eat, you know, certainly depending on your dietary law rules and so on, you know, that should be a personal decision. But any type of food is not bad food. There is no shame in eating any particular type of food.
Well,
That's
I would like to say one thing, that you can say all food is bad, or all food is not good, but you have to realize one thing. If you're not disciplined to what you see that comes before you, then you're really in the point of you're going to accept what the commercial world advertises for you to eat. Number one, when people grew up years ago, the parents were more at the point of saying, okay, I want my child to eat a decent meal, not garbage. And you would not eat candy, because candy was forbidden, because you would spoil your appetite. But today, when we have a society that is constantly being bombarded with a lot of sugar, a lot of refined foods and garbage, that you can't even find anything that's natural anymore. Then they want to give you genetically engineered food, which in turn is more dangerous. So in the sense that people are dying faster through the spoon to the grave than they are trying to live.
Well, you bring up a lot of controversial issues, James. I think that and we do talk about this a lot in the community, that is this a willpower thing? Is this a discipline thing? Is this a matter of what are we should we feel more shame and guilt about what we're eating so that we can restrain ourselves from eating it? Keeping in mind that with eating disorders, that we're talking about something a little bit different, and that is that someone who's eating doesn't feel safe eating any type of food. Food is the enemy. It is an obsession. It's an extreme form of what we're talking about. It's not just someone who is, you know, eating too much fast food because it's convenient and so on, or just grew up on it because it was less expensive and that was what was available to them. It's something that causes a great deal of shame and guilt to begin with. So what we don't want to do is give people the idea that they should feel any type of shame or guilt about eating any type of food whatsoever, because that can exacerbate an eating problem.
Well, I mean, in many cases, look at the amount of coffee the average American drinks every morning. We don't hardly even think that
This is water, by the way.
Right.
Okay.
But I mean, look at the amount of money that's made off coffee. And you say, why is it that everybody has to drink coffee in the morning? Well, number one, coffee is a drug, which in turn was used as a commercial medium of sort of hyping a person. When a person goes to work, the first thing he wants to do is get a cup of coffee. Then he winds up becoming, oh, I'm sick, I don't feel good, I have to have something sugar in there. So in the sense that if a person would say, well, wait a minute, we have to get rid of the coffee and start thinking about drinking something that's natural. I mean, in other countries, they don't drink coffee. Coffee is a luxury, but they drink tea. So in the sense that more people today are drinking green tea because they know they don't want to be bothered with this harsh taste of coffee, the miserable taste of it, but yet society says, well, you got to have a cup of coffee. Well, what do I need coffee for? So in a sense, if you can discipline yourself and say, wait, I don't need that coffee. Why should I spend $5 for a cup of coffee from Starbucks, where I can almost get a cup of tea, something that's going to help me, not hinder me? Then I can work better. I wouldn't feel frustrated or cravings.
You bring up some very interesting points, James. I think a lot of us, and a problem with a lot of us, is that we're not very educated as far as nutrition. And I think it's the commercial dictates that we follow a lot more than plain common sense. And certainly even a lot of medical personnel are not taught accurately about good nutrition, the food groups, and I think it's something we all really need to look into as far as general health, aside from eating disorders. But we thank you for your call, James, and you make some very good points.
Thanks,
James.
Thank you. Good night. Now, in reference to a question I had asked a little earlier, with someone having had a very loving family and comforting family and still developing a self-esteem problem. Now, parallel to that, have you found that people that were very attractive by conventional standards and who you feel wouldn't have any problem attracting the opposite sex or what have you, had serious self-esteem issues and saw themselves totally erroneously?
Absolutely. As a matter of fact, the more emphasis that is put on a person's appearance, especially if they were very attractive growing up, the more they believe that that is the main way in which they should validate their worth. So I find that some very attractive people are much more obsessed with having to be attractive all the time, maintaining that standard.
What kind of personality, though, accompanies a person like that? Would you find that there's more of an arrogance, a condescension, a sense that this is what I have and this is what opens doors for me, or this is what attracts people to me, or is it a liability?
Actually, I don't think of it, I guess when I use the terms arrogance and so on, I'm really thinking of a narcissistic stance. When we use the term narcissistic, we're referring to somebody who uses that type of posture to make up for the fact that deep down they don't feel valuable.
Okay.
So, and I don't look at, let's say, an eating disorder as a problem of vanity per se. A person that obsesses about needing to look a certain way all the time has a very low sense of self underneath it all. And I guess every time, when you run into a person who seems to think that he's the answer to all of the world's problems, is the greatest thing since sliced bread, I usually think, this person must really not feel that great about him or herself. So that's what's underneath all of it. I don't necessarily believe that a person who is attractive, let's say, and actually perceives themselves as attractive is always vain or narcissistic in a negative way. It's good to have healthy self-esteem. It's good
Sure.
to look in the mirror and say, you know what, I look pretty good. Not too shabby. That's
Right.
good. That's a good sense of self. That's a good, healthy narcissism. And that same person can look in the mirror and go, this color's not so good on me. I really think that's within normal range. That's healthy.
But it's when it becomes either obsessive or narcissistic that it becomes a problem.
Right, and again, only if that interferes with the person's functioning and in that person's relationships where they're not feeling fulfilled, does a person really seek out treatment. It's not for me or you or anyone to say how a person really can live their lives. They're going to have to, it's trial and error,
What are some exercises per se, and I don't mean physical exercises, but some routines a person can do every day? Say 3 things that a person can do who may not feel particularly good about themselves. What are 3 things they can do that can sort of bolster their self-esteem? Would it be looking in the mirror and say, I'm not so bad? Or, I don't know, write 3 things about themselves that are good. Is there anything like that?
Yeah, that's funny. I actually, people always come into my office and they say, you're not going to tell me to go in the mirror every morning and say, I'm wonderful, I'm a beautiful person. And I don't. I don't think that works. I mean, it may work for you, but I haven't found it to be exceptionally effective. Instead, the recommendations I make are usually to get rid of the things that make you obsess about your body and your appearance. Get rid of the scale. People don't do that, but get rid of the scale. Burn it.
We have Jim on the line, Jim from Queens. Welcome to Talking About. You're on live.
Hello.
Hi.
Hey, Jim.
How's it going? My question, I missed the segment earlier that was dealing with male anorexics,
Yes.
but I had a few questions. I was wondering what your advice was for male anorexics who are suffering to the point that they're actually gaunt and skinny and up to the point of hospitalization. And I was wondering what your advice is for friends of them.
Well, first of all, as with females with anorexia, same holds true for males. The most important thing is getting the treatment that you need in order to recover. Unfortunately, there are not that many treatment programs, residential or intensive outpatient programs that specialize in treating eating disorders in males. There are a few out Midwest, and the Eating Disorder Council can give you that information if you're looking for it, because we're a referral service and we like to help people find the resources that they need. So if that person is getting the help that they need, then there's a likely chance they'll recover. As far as friends and family members, it's the same thing. There's very little that you can actually do to change the situation. You cannot make a person eat if they don't want to eat, if they're afraid of eating. Keep in mind, a person who's anorexic is petrified of food. It's a love-hate relationship, but it's very difficult. You don't put someone who's afraid of elevators, you don't shove them into an elevator. That's going to result in quite an incident. So what we do is we have treatment programs that very slowly help that person change their relationship with food. Friends and family, as long as they can put up with it, I think you need to be supportive and understanding and try to read as much as possible and listen. And I don't think that you'll ever be able to understand completely what he's going through, but you would be able to have a better understanding.
Very good. Thank you.
Thank
You're
you.
welcome.
Thank you for calling. Do you find that it's a pattern that people, say with self-esteem issues or eating disorder issues, attract people of abuse in their lives?
Absolutely. You asked for some recommendations on what one can do to prevent this type of low self-esteem and, I guess, chaotic relationship with their bodies and food. And one of the most important things a person can do is to have healthy relationships in their lives. So, and yes, it is very common for folks who feel out of control of their lives, who are using food in an unhealthy way, to have the type of relationships in which they don't get their needs met. Think about it. A person who has anorexia doesn't allow any nurturance in, doesn't allow any food, any desire, pleasure in. They're people pleasers. They tend to do everything for others. And someone with bulimia takes it in and then feels guilt and shame about it afterwards and gets rid of it. And keep in mind that also people with anorexia may also do those types of things as well. Get rid of it afterwards. There's a shame about allowing oneself to partake of pleasure and to be in a relationship where their needs can be met. And so they tend to be in relationships that are unsatisfying and unhealthy and oftentimes abusive, yes.
Yeah, see, it's shame once it becomes a situation where it's like you are what you attract, or you're attracting like, and that's very sad, especially when you're in a predicament where you need the most support network around that you possibly can. The lady that called earlier explained that the person had been in a love relationship that ended, and is that often a precursor or an effect of eating disorder, maybe guilt or shame, or punishing oneself for not having succeeded in that type of relationship?
Absolutely, and in addition, also, someone who responds so severely to a breakup really is unable to see that it's not necessarily about him or her. And in relationships in general, that person, it's a boundary issue. We say boundaries, It's a boundary issue because a person maybe grew up believing that if somebody withheld, had negative feelings towards them, that meant that they had no worth whatsoever. That if someone feels something negative, that means they've withheld love from them and they must not be valuable, they must not be worthy. So a breakup like that can be extremely damaging to a person like that.
What would be your approach to somebody like that who is coming to you after a breakup?
First, the most important thing I think that all therapists do is establish a healthy relationship with their patient. Through that relationship, it's a model for other healthy relationships. So there has to be a lot of mirroring and validation and listening and really just trying to allow, and most people when they're experiencing a loss, a breakup or any other type of loss, have good reason to be upset. So in this society we're told, no, you shouldn't have negative feelings, don't get upset, don't freak out, don't get hysterical, but those are normal human emotions. Don't feel jealous, rage, those are normal. So we're supposed to repress them, we're supposed to feel like we're nuts if we feel them. And usually the most important thing to say to someone who first comes in is, you're feeling what you're feeling, it's normal, there's nothing wrong with you. You're just here to try to learn how to cope more effectively with them. That's okay.
I know I've always said, and I've written, that it's the sensitive people in our society who are the ones that foot really the bill, I think, for everybody else, because they feel things more, they sense things more. And something that might be minuscule to one person, the sensitive person is going to feel 10 times as profoundly. And I would imagine, I don't know this for a fact, but I would imagine a lot of the people afflicted with whom you come in contact are people of great sensitivity and to some degree maybe too sensitive for this world, because this world is becoming harder and harder to live in as we speak.
Absolutely.
And we definitely need more people like you to listen and to support and to really show people that there is hope and that there is light at the end of the tunnel. The future of your organization, how long have you been active now?
The Eating Disorder Council of Long Island has been around for almost 10 years.
Wow.
We're a nonprofit organization, the only organization of its type providing resources and education to professionals and the community on eating disorders. We're all volunteer organization, professionals and lay people.
And we are nearing the end of our hour, how quickly the time flies, but I close every interview with this very last question. What unique contribution do you hope to have brought to the world at the close of your career, and when all is said and done, what unique contribution do you hope to have brought that hadn't been there before Cynthia Pizzulli came about?
Now, you asked me this last time,
Yes.
and I
And
didn't
I'm
think you were going
asking
to
you
ask me again, and I still haven't prepared. What does that say?
Well, just
Okay.
go with the instinct.
Go with the flow. I think that the most important thing that I would like to have brought to this world is the belief that we're all entitled to happiness. And it sounds a little bit corny, the pursuit of happiness, but we're all entitled to have our needs met. We're entitled to have healthy relationships and to be desired and be able to follow our passions and be fulfilled in life. That's a lot, though.
That's a lot, but
Yeah.
it's wonderful, it's very accurate, and I think we all have the right to be happy. And if there's any more valuable contribution, I don't know what it is. But once again, it's terrific having you. We hope you'll definitely come back and join us again.
It's my pleasure.
And we will see you in 1 month again for Talking About Live. We are recurring every month, Monday nights, 8:30 p.m. live. We welcome, of course, your questions and comments, any input whatsoever. This is an interactive show. It's a show for you, and we definitely want all of you to be a part of it. And we also welcome your input on the website and the email address that you'll see at the end of this program for any questions or comments, or if you're interested in possibly being a guest with us and definitely have a cause or some issue that you feel needs greater exposure. That's why we are here for you, the community, and we thank you for joining us, and we definitely wish you a pleasant evening. I'm Christopher DelGaudio, thanking you for joining us on Talking About. Good night. Thank you.
You're welcome.
Did a great job as always.